What should you do if a child vomits after antibiotics? Imagine giving your child their medicine and then suddenly seeing them vomit. It can be confusing and worrying, but understanding what to do next is important. When a child vomits after taking antibiotics, the first thing to consider is how soon after the dose the vomiting happened. If it occurs within 15 minutes and you see the medication in the vomit, it's usually recommended to give the dose again. This helps ensure your child gets the full amount of medicine needed to fight the infection. If the vomiting happens after 15 minutes but within an hour, you should be cautious. It's best to consult your healthcare provider before giving another dose because there's a risk of overdose or the medication not being absorbed properly. If more than an hour has passed since the medication was taken, usually there's no need to repeat the dose. Vomiting in children after antibiotics is quite common and can happen for several reasons. Sometimes the taste of the medicine is bitter, or the child's swallowing reflex isn't fully developed. The underlying illness itself can also cause nausea and vomiting. It's important to remember that if your child vomits, it might reduce how effective the antibiotic is because less of the medicine gets absorbed into the body. Keep an eye out for signs of dehydration, like dry mouth, crying without tears, or fewer wet diapers, especially if vomiting is accompanied by diarrhea or stomach pain. Blood in vomit or stools is a sign that needs immediate medical attention. If your child keeps vomiting and cannot keep any medication down, do not try to force them to take more medicine. Instead, contact your healthcare provider promptly. They might suggest changing the antibiotic, adjusting the dose, or switching to an injection if necessary. Sometimes, giving the medication with food or in smaller, more frequent doses can help reduce nausea, but always check with your doctor before making these changes. Remember, never give your child medication without professional guidance, especially if vomiting continues or worsens. In summary, if your child vomits after antibiotics, check how soon it happened and if the medication is visible in the vomit. If it's within 15 minutes and the medicine is seen, redose after talking to your healthcare provider. If it's later, seek medical advice before giving more. Always watch for signs of dehydration or worsening symptoms, and stay in touch with your child's doctor to ensure they recover safely and effectively from their bacterial infection.